Total T, free T, oh my God, you scared me. But you know what's really scary? Trying to interpret your own lab results without a medical degree. But don't worry, on today's episode of MTP, I got you. All right, now welcome back to Meet the Penis, episode 106, Lab Results Decoded. In our last episode, I got my blood drawn to kick off Men's Health Month, and today we're breaking down what all those numbers actually mean, so you don't panic when you see your lab report and wonder if your cholesterol is texting your testosterone behind your back. We'll be talking about the core labs in a men's health panel and how to interpret them, using both general lab ranges from places like Quest and LabCorp and the clinical guidelines we follow as urologists like those from the American Urological Association. So let's get into it. First up, total testosterone. Labs like Quest or LabCorp might say normal is anywhere from 250 to 1100, but that's a wide range, and here's where symptoms matter. According to the AUA, if a man has symptoms of low T and his level is under 350, we consider that clinically low testosterone. So even if the lab says you're normal, we may still recommend treatment based on how you feel. Now, free testosterone is the fraction of T actually available to do work in your body. Low free T can cause symptoms even if your total T is in range. Now, next up is PSA. This little guy screens for prostate issues. Normal depends on age, but generally we like to see it under 4. Higher numbers don't always mean cancer, sometimes they mean trauma, but they do mean we want to take a closer look. It could be BPH, prostatitis, or even a reason to get a prostate ultrasound. Now, the lipid panel is your cardiovascular vibe check. Total cholesterol should be under 200, LDL, which is the bad stuff, should be under 100, HDL, which is the good stuff, should be over 40, triglycerides under 150. If you're high in all the wrong places, we'll talk about lifestyle changes and maybe medication. Now, CBC looks at red, white blood cells, platelets, hemoglobin. Low red blood cells, it could be anemia, or high white blood cells, maybe inflammation or infection. It's like a surveillance camera for your immune system. Now, LH and FSH help us understand why testosterone might be low. If LH and FSH are low and your testosterone is low too, your brain might not be signaling your testicles properly. If they're high, but your test is still low, your testicles might not be responding. That's how we tell if it's a pituitary problem, a testicular issue, or even both. Sex hormone binding globulin is a protein that binds to your testosterone in your blood, and too much, it can lock up your testosterone like a jealous ex. That's why we measure free T and not just total. So what's the takeaway? Lab results are only part of the picture. We use your symptoms, your history, our expertise to make sense of it. Not every normal is your normal. If you've got questions about your results, don't Google yourself into a panic spiral. Talk to a pro. Here at Preto Clinic in Coral Gables, we specialize in men's and women's health panels, and we'll help you figure out the best next step, whether it's optimization, treatment, or just peace of mind. Now that's it for MTP 106 Lab Results Decoded. Still confused? That's okay. Just don't ignore it. You're not a lab report, you're a whole person, and we're here to help you feel like your best self. So catch you next time, stay smart, stay optimized, and drink some water.